So today, I'm gonna give you a sample of what ProLong mobility is. You're gonna get yourself a nice sturdy chair. It can have armrests or not, as long as it's sturdy and stable and doesn't wiggle. You don't wanna be sitting there like a lazy boy or anything like that. I want you to go ahead and slide forward, bring your hips forward to the edge of the chair. Make sure you have some room between your back and the backrest of the chair. I want you to put your feet out in front of you, heels down, toes up. Put your hands on the inside of your knees and run those hands down the inside of your knees. Make sure your legs are a little bit wide and come down all the way down till you get down to that anterior, or should I say interior malleolus, your medial malleolus bone right here on your ankle. I want you to count to 10 for me. 9, 8, 7, 6, 5, 4, 3, 2, and 1. We'll come back up. Simple hamstring stretch with hand placement on the inside. Now we're gonna take our hands, bring them all the way around, put them underneath our knees, top of the calves, and run our hands down as far as we can. Maybe grab those ankles, grab those heels. If you can wrap your hands around your feet, that's fine. But another 10, 9, 8, 7, 6, 5. Don't forget to breathe. 4, 3, 2, and 1. Come on back up. Don't worry about how far you went down. Just want you to be able to get the range of motion movement going. This is your sample session here with ProLong Mobility. The next thing I want you to do, you can do it with shoes on or off. I want you to put the insides of your feet together, soles of your feet together. And I want you to put your hands on the outside of your knees. And what I want you to do is I want you to squeeze in. If the knees touch, that's fine. If they don't, that's fine too. I'm really focused on that anterior side of the ankle, the anterior malleolus, the outside ankle bone right here, squeezing in on those knees. Like I said, if they touch, that's fine. If not, that's fine too. You just want to do it to the point where you feel most comfortable when you actually start to feel it. I didn't count that time, but go ahead and relax. Let's go ahead and do it again. We're going to put our hands on the outside of our knees, squeezing in. Kind of let your knees come in on their own. Your hands are there as a guide. Go ahead and squeeze them in. I'll count this time. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. We'll come on back out. I kind of do exercises maybe 2, maybe 3 times. Before moving on to the next one, we'll do it one more time, squeezing in. You might find your knees getting a little closer this time. Hopefully you don't have any pain on the outside portion of your foot. Depending on what shoes you're wearing. You might even be doing this barefoot at the time. And let's go ahead and relax. Good. Let's slide back in our chair. Slide back in our chair. We'll sit up nice and tall, your head up, chest up. We're gonna pick our feet up off the ground so the feet are off the ground. I want you to rotate the ankles around in a circle. Sometimes I do it down on the ground like this, but I can't really get a lot of range of motion in my ankle. So I bring the feet up. And the reason why we bring the feet up is because now I can get a full range of motion around that ankle. Doing rotating this way. Now let's rotate back the opposite way, whatever way that is for you. Let's do another about 5, 4, 3, 2, and 1. I haven't really explained much right now at this present moment about what areas of the body we're going to be working on today, but I did do some of the hamstring, ankle, start working my way up the body till I get up into this shoulder area. So let's go ahead, focus on our knee right now. Let's go ahead and hold on to the underside of our knee. Keep one leg bent, bring the other one straight. Let's bend it back and forth. Kind of like let that leg just swing almost like a pendulum on a clock. We'll set that leg back down. Put one hand on top of the other. And reach down, see if you can touch those toes as best you can. It's really gonna pull on that lower part of the hamstring, upper portion of the calf. I'm pulling back on my toes. If you could do that, that's fine. If not, if you could just touch the toes, that's fine too. If you only get to about right here, that's fine too. I want you to do and get to the point where you're most comfortable. Everybody has a starting point. Nobody starts at 100. Take your time. 8, 7, 6, 5, 4, 3, 2, and 1. Let's go ahead and take that same leg. We're gonna interlock our fingers first, hold on to that knee, and kind of let that leg Rotate around the circle. I'm trying to rotate that femur and that hip. Feel free to continue to breathe in and out. Go back the opposite direction, whatever way that is for you. Yep. I'm gonna do it. Put that foot down one more time, heel down, toes up. I'm gonna put my palms up towards the ceiling. I'm gonna scoop down, lean forward, come back up. So I got a lot of motion at the waist. I'm reaching down. You might find this a little easier to do than holding a hamstring stretch by reaching down and holding. Here you get to rock back and forth, kind of get yourself lower and lower or closer and closer to that foot every time. Chair's a little squeaky today. That's okay. One more time down. Let's go down and hold. Grab what you can for 5, 4, 3, 2, and 1. Come on back up. We'll do the same thing on the other leg. So with the other leg, what we did first is put that leg out in front of us. We're gonna reach down with one hand on top of the other, reach down, see if we can touch our toes, ankle, bottom of the pant leg, shoelace, tongue of the shoe, whatever it is you could grab. Reaching down, 10, 9, 8, 7, 6, breathe in and out, 5, try not to hold your breath, 4, 3, 2, and 1. Come on back up. Definitely take a couple of deep breaths in. Let's start by taking a deep breath in through our nose. Exhale back out of our mouth. And then we'll take another big deep breath in through our nose. And then exhale back out of our mouth. This time we're gonna interlock our fingers. Go ahead and grab that knee. Circle it around in a circle. Our knee really isn't moving around in our circle at all. Knees don't rotate, they bend. What's rotating right now is my femur and my hip. You can't rotate a knee. You can only bend it back and forth. It just looks like I'm rotating the knee because I'm moving it around the circle. Go back the opposite direction. Good, about a few more times. Last time all the way around. And we'll straighten that leg back out, heel down, toe up. Remember what we did the last time? Now we're gonna do it again. Palms up towards the ceiling. We're gonna scoop. We're gonna reach down and scoop. A lot of hinging on the waist. This is gonna help us get down. If you're struggling getting down to touching your feet or grabbing your toes, this motion right here definitely helps with getting you down there a little bit more because you're warming that leg up. Let's go ahead and go down one more time and hold. Grab what you can. Some of you are here. Some of you are grabbing the tongue of the shoe. Some of you are touching the bottom of the pant leg. Let's go 8, 7, 6, 5, 4, 3, 2, and 1. Let's come on back up. Good. Let's get into our hip. What I like to do is we'll do that same interlocking of the fingers with our knee. We'll bring that leg up, and we're gonna cross this leg over here. So I got an alternative for this. I'll show you the first one. I'm gonna sit up nice and tall. Make sure your back is off of the backrest of the chair. I got one hand underneath my knee, underneath my leg, and also on the bottom part of my knee. And this hand kind of like right here on the ankle. You can put it on the foot as well if you want to, but I want you to just pull in on that leg. You're sitting up nice and tall. And what we're gonna do is we're gonna lean forward with our chest and our head leaning forward. We're trying to take our head and our nose over this knee. The more you lean forward, the more you're gonna feel this back in your hip. I can get into the muscles of the hip at a later time. But right now I wanna sit up nice and tall and lean forward. But I do have an alternative, and that's this. If this is too hard for you to get up here and do this, let me show you an alternative. We're gonna do this as well, but let me show you this. What happens is you cross at the ankle. See how I'm sitting, I'm crossed at the ankle? And all you have to do is put both hands on the top leg and just lean forward. It will be nowhere near as intense as with your leg up, but some can't get their leg that high up. Here, you can have one leg crossed over the other. You can even pull up on it just a little bit if you'd like. See how I pulled and separated my feet from resting on each other and lean forward. You're gonna feel more, a little bit, the hamstring more than anything. But that is an alternative I want you to do if this motion here is this position, I should say, is too much or too intense. So let's begin. You have the alternative, one leg over the other, or right here. Let's pull in on our legs, sit up nice and tall. We're gonna lean forward for 10, 9, 8, don't hold your breath, 7, keep breathing, 6, 5, 4, 3, 2, and 1. Now you're gonna lean back in your chair, rather you were in this position here, or if you were in this position here. Once you're leaning back in your chair, catching your breath, giving that hip a chance to relax. Now let's do it again. Underneath the leg, come underneath the leg, grab right here, take the other hand, put it right here on the tongue of the shoe, or top of the foot, pull in on the leg. Let's go ahead and lean forward for another 10, 9, 8, 7. You should be feeling this back in your backside. 6, 5, as you lean forward, 4, 3, 2, and 1. Go ahead and sit up nice and tall. As you lean forward, you should start to feel it more intense in that, right down in that glute where that hip is at. Go ahead and lean back in your chair, give yourself a chance to relax. Rotate the ankle while you're doing this. The reason being is because your anterior tib, your outside portion of your calf, is resting on that thigh and it's digging in there a little bit. So I rotate the ankle to alleviate some of that pressure. And we'll sit up nice and tall. I'll do it one more time. Pull in. Let's go ahead and lean forward. It's another 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Let's go ahead and lean back in our chair. Hold on to that knee and rock it back and forth. Remember when we did that earlier? We do this because we had so much torque on that knee, turning that knee over to the side. Now I'm having you rock that knee back and forth. And I'm gonna put that foot back down. We're gonna put our hands underneath our leg again. Go up and down, right along the side, both sides of that knee. Because we had a lot of torque on that knee, turning it to the side this way. Now I want us to try to go back to elongating it. Up and down. Good, let's sit ourselves up nice and tall. We're gonna do the same thing on this leg, and then I'll transition up into our spine and on our shoulders, and then we'll go from there. Let's bring this leg up, rotate it around just briefly, any direction you want, preferably to the outside. Now go back, come on back inside, and then bring this leg up over the top. Again, if you can't do this high, you can always do it down in here. You can do it down in here, it's not as intense. You can even cross at the ankle if you can, also not as intense. It's just another alternative you can do if this position is just a bit too much. Hand on the top of the foot, tongue of the shoe, come underneath the leg, press that hand right there underneath the bottom part of the knee, pull in on the leg. We don't want to focus on pushing down. It's too much pressure on the hip. I want us to pull in and lean forward. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Go ahead and lean back. Rotate the ankle around. I'm gonna speed this one up because you know how to do it now. We'll do the last two a little bit faster. I'll do an exercise with our spine and our shoulders, and you'll have a pretty good idea of how ProLong mobility is gonna benefit you in the long run. Let's sit up nice and tall. Let's go ahead and lean forward. These last two, let's go 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Go ahead and lean back. I do a lot of 10-second stretches instead of 30 seconds at a time. I just break it up and do 10 seconds at a time. It really helps with knowing how much longer you got to hold these positions, but also, holding something for 30 seconds, could feel like an eternity. Let's sit up nice and tall. Let's go ahead and do it again. This last time right here. 10, 9, 8, 7, 6, 5, 4, 3. Keep leaning forward. Keep breathing it out. 2, and 1. Let's go ahead and set that leg back down. Holding on the underside of our knee. Bend it back and forth. Remember all that torque we had on that knee? We want to get that knee moving like it's supposed to be, because we don't swing it like this too much. We don't want to. I'm just trying to get you to bring it back to front and center, over and over again. As you set that heel down, toe up, hands underneath the knee or on the side, and we're just going up and down, up and down. It's subtle, up and down. And then good, we'll come on back up. We're gonna focus on our spine. Let's take our hands, we're gonna place them on our low back. We'll place them on our low back, okay? So I got my elbows out, my feet are flat, knees are bent, and I want us to go around in the chair like a hula hoop. Now, if you have armrests, I kind of have some, but not really. If you have armrests, you might have to put your hands maybe over top of the armrest, maybe here, because the armrest is getting in the way. That's okay, you can adjust. You don't want to really go through the armrest, because then that's weird. Or the best thing is sit forward in your chair to kind of avoid the armrest. But put your hands on your low back, make your feet flat, knees wide, and rotate around that chair from hip to hip. Let's go back the opposite direction. Good, good, good. Keep going around. 5, 4, 3, 2, and 1. And now this time we'll bring our feet in a little bit more. Put one hand in front of you, looking straight ahead, kind of at the back of your hand, and then the other one going straight back. Keep looking forward, put your other arm straight back. Want to get a nice turn on that middle portion of our spine, or called the thoracic part of our spine. 3, 2, and 1. And then we'll go ahead and switch. Keep looking forward. We'll put the other hand out in front. Bring this one back behind us. Still keep those knees and feet facing forward. Kind of staring at the back of my hand. 5, 4, 3, 2, and 1. And back. Good. Let's go ahead and do something that I really like to do during these exercises, is work with our cervical or our neck. This one here, you get to kind of slide back in your chair. You're gonna have your hips all the way back in the chair, get your, your pelvic floor to relax, and go ahead. You can do this with your eyes open or closed. And all we're gonna do is we're just gonna rotate our head around in a circle. And it's gonna sound kind of noisy in there. It's gonna sound, a lot of my clients in classes, they kind of say it sounds like Rice Krispies, like snap, crackle, and pop. Or like dry frosted flakes in a bowl. That's just air being released in the joint in that cervical. If there's any pain when you do this, stop right away. I don't recommend fighting through the pain in these exercises. We're here to try to alleviate pain and bring healing, not try to push through and prove anything. Go back the opposite direction, whatever way that is for you. Again, you can do this with your eyes open or closed, either way. Just want you to sit relaxed and comfortable in your chair. It's gonna feel particularly noisy when you come around in certain positions. Feel free to hold for a second or two in certain positions if you feel that's a little tighter than normal. Keep following through on that same direction you were going. Good. Let's bring ourselves back up. You can reopen up your eyes if they were closed. I did a really short tidbit on what ProLong Mobility can do for you. ProLong Mobility is a program designed to help you increase your range of motion, but also do it having less pain, or having the goal of achieving less pain while trying to move. If this is something that interests you and you want more of, please feel free to join this program. I'm telling you, I promise you it's gonna benefit you greatly or a loved one. This is just a sample of what we do. I have balance exercises, I have strengthening exercises, all can be done at home, minimal weights, with clear direction and a purpose behind every movement. Thank you for joining me today, and I look forward to seeing you in the full session with ProLong Mobility. Take care.